Taking an oral temperature occurs when the mouth is used to take a patient's temperature. Taking a temperature measures the patient's body heat. An oral or a digital thermometer may be used to take a patient's temperature. A person should be 5 years or older to have a temperature taken by mouth. Why do you need to check an oral temperature? You may need to check an oral temperature to learn if your patient has a fever. Fever is a word used for temperature that is higher than normal body heat. A fever is usually a sign of illness, infection, or other conditions. The normal oral temperature for adults is about 98.6 degrees Fahrenheit or 37 degrees Celsius. The normal oral temperature for a child is between 97.6 degrees and 99.3 degrees Fahrenheit or between 36.4 and 37.4 degrees Celsius. The normal oral temperature for older persons is about 96.8 degrees Fahrenheit or 36 degrees Celsius. Body temperature changes slightly throughout the day and night and may change based on the patient's activity. Mercury thermometers were once the standard for glass thermometers. They are thin glass tubes filled with a silver tip and a gray line. That silver tip and the line is mercury. Mercury is a toxic and hazardous chemical. The Environmental Protection Agency and the American Academy of Pediatrics and other organizations warn against using mercury thermometers. If the thermometer breaks, the mercury may be inhaled or absorbed into the skin. If a glass thermometer breaks while checking an oral temperature, the patient may swallow the mercury. Mercury is bad for human health as well as for the water, wildlife, and waste systems of the earth. It is better to replace a mercury thermometer either with a glass thermometer having alcohol or Galveston or a digital thermometer. As a precaution, with a broken mercury thermometer, do not touch the thermometer or the mercury. Do not try and clean up the spill. Open your windows to air out the area. Take children and pets out of the area right away. Contact the 24-hour nationwide poison controls hotline at 1-800-222-1222 or on the World Wide Web at www.poison.org. Glass thermometers with alcohol inside may be used for oral temperatures. This thermometer has a red or blue line inside. Glass thermometers with Galveston may also be used to check oral temperature. Galveston thermometers have silver-colored line inside, but that is similar to mercury thermometers, but will be marked mercury-free. Digital thermometers are also used to take oral temperatures. They are small, handheld devices with a window showing the temperature numbers. There are many kinds of digital thermometers. Most digital thermometers are easy to read and easy to use, and they measure a body temperature within seconds. Carefully read the instructions before using a digital thermometer. To take an oral temperature, first collect your supplies including a glass or a digital thermometer, disposable probe covers for clean and sanitary procedure, alcohol wipes to clean the equipment, a watch or other timepiece to measure the length of time in the mouth, and writing material to accurately record your patient data. After properly identifying your patient, hand hygiene should always be the first step in a patient encounter. If possible, do this upon entering the room before touching the patient. You can either wash with soap and water or use an alcohol-based hand sanitizer. So, how do you correctly take a temperature with a glass thermometer? Well, after entering the patient's room and confirming the patient's identity and doing your hand hygiene, assess the patient for oral intake. There should not be anything hot or cold in the patient's mouth for at least 10 minutes before taking a temperature. If this has occurred, return after about 30 minutes to take the temperature or choose an alternate route. Take the thermometer out of its holder. Hold the thermometer by the end opposite of the colored tip. Clean the thermometer with soap and water or rubbing alcohol and rinse with cool water. Do not use hot or cold water. Turn the thermometer in your hand until you see the red, blue, or silver line. This line should read less than 96 degrees Fahrenheit or 35.6 degrees centigrade. If the line reads more than 96 degrees Fahrenheit or 35.6 degrees centigrade, tightly hold the thermometer between your fingers and shake the thermometer down several times. A good idea would be to shake the thermometer over a soft towel. This will keep it from breaking if it accidentally slips from your fingers. Check the thermometer again and make sure it reads less than 96 degrees Fahrenheit or 35.6 degrees centigrade. Slide a sterile probe cover over the end of the thermometer without touching the tip. And always tell your patient what you're going to do, because this will make your job easier. Next, ask your patient to open his or her mouth. Carefully place the thermometer tip under the tongue on a heat pocket. There are 2 heat pockets located, one on the left side and one on the right side on the floor of the mouth under the tongue. Hold the thermometer in place. Do not let it go. Instruct the patient to gently close the lips around the thermometer. Make sure that the patient does not bite down on the thermometer. This could break the glass and cause injury to your patient. Wait at least 3 minutes and then have the patient open his or her mouth and gently remove the thermometer without touching the tip. After you have removed the thermometer from your patient's mouth, carefully wipe the thermometer with a gauze or tissue. To read the thermometer, hold it at eye level, then slowly turn until you can see the red, blue, or silver-colored line. Each long mark on the thermometer is the same as 1 degree. The short marks between the long marks are equal to 0.2 degrees. Read to the nearest 0.2 or 0.1 degree. Next, you must record the patient's temperature. Make sure that you include the patient name, the time, and the route of taking the temperature. Wash the thermometer with soap and water. Do not use hot water because it might break the thermometer. Then place the thermometer in a soiled container. Do not reuse for another patient without first sterilizing the glass thermometer. Again, as always, following patient contact, perform good hand hygiene and wash or sanitize your hands. Now let's take a look at an easier way to take an oral temperature using a digital thermometer. As always, before touching the patient, perform good hand hygiene with soap and water or hand sanitizer. Assess the patient for oral intake. Remember, there should be no hot or cold intake within the previous 10 minutes. This would include no smoking or gum chewing. If these have recently taken place, wait and take the oral temperature in about 30 minutes or choose another route to take the patient's temperature. Remove the thermometer from the holder and place the tip in a disposable probe cover. If a probe cover is not available, you may clean the tip with soap and water or by wiping with alcohol. Make sure and rinse in cool, not hot or cold water. Ask your patient to open his or her mouth, then gently place the thermometer probe under the tongue either on the right or left side. Have your patient close their lips gently over the thermometer. Make sure they're not biting down with their teeth because this can cause damage to the patient's mouth or the metal probe. Hold the probe in place until finished. Keep the thermometer under the tongue until it beeps. Remove the thermometer when numbers appear in the window. Read the data in the window and record it. Include the patient's name, date, and time, and the route you used to take the temperature. Then you can remove and throw away the probe cover and replace the probe in the holder. Repeat your hand hygiene, and that's all there is to it. Digital thermometers rock!